Task Force Steering. Oops. Sorry about that.
Go ahead.
I will call to order the Incarceration Prevention and Reduction Task Force Steering Committee meeting for July 8th, 2021. It is 11 a.m. and we're meeting virtually. Before we begin, I'd like to acknowledge this and read this into the record. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for this and tendered this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that brings us together here today. And please join us in uncovering such truths at any and all public events. So with that, thanks everybody for being here. Happy July. And I guess our first item is items for our next task force agenda. And Jill, did you want to, what do you have on the agenda so far? I guess, can we start there?
Yeah, so far I don't have anything.
Okay, that's a good, we got a blank slate then. Okay, let's brainstorm this, folks.
Hey, I've got an item here. I want to understand how the task force is going to address or not address House Bill 1310, which is greatly impacting how police and sheriff's office will be responding to or not responding to certain types of behavioral health calls, especially those that end up not having a criminal component to them. This has been the talk of the town for about a month now. This goes into effect on July 25th. We've been trying to get an alternate response team up and running that would respond with, it'd be a response to 911 calls with
Right.
With the EMTB and a behavioral health specialist in a specialized vehicle. We are nowhere, we have done a lot of groundwork on this, but we are, because of the way governments hire and acquire vehicles, especially in the age of COVID, when there's a chip shortage, apparently, we are probably about a year out from implementing this alternate response. But the broader piece is I want to understand, and I don't know to what degree you guys have been following this, but I want to understand how the task force is going to address 1310 and then I think the 12 other bills that came out of the legislature, in the last session that have to do with everything from use of force to behavioral health stuff and setting them limitations on policing. So that's one of my things I want to figure out.
Dan, if you were king of the world, how would you want the task force to address it?
Well, I think 1310 was well intended, but I think it needs a legislative fix. And so I think a recommendation to the legislature for their next session, I don't know if they could hold a special session in between now and July 25th. I highly doubt it. But there won't be a response to a person who's having a behavioral health crisis. And I'm really concerned about that. I was also contacted by Lake Whatcom Treatment, and Britta Johnson cited a different bill that affects ITA holds. So Involuntary Treatment Act holds by police, they're not doing it. And she's saying that what's happening is that because there's not that intermediate step, that she's had several patients that have ended up in jail because there was not an intervening component. And so I'm really worried about people drawing charges, because if they're escalating and then they become assaultive or they commit some kind of crime, then suddenly they've got that charge and maybe conviction later. And I'm worried about them obtaining housing and just what the downstream effects are. And people are not getting the care that they need. So those are those are my concerns. I think maybe a recommendation to the county council that some of these things be adjusted so that that better patient outcomes and community safety can happen. But right now, they've gone in a way that it seems like they were trying to address something, and then it became. I think that unintended consequences were not completely thought through.
So Dan, let me ask you, is the health department tied into all these bills? Are they obviously they're aware, but are they? I know I talked to Ann last week about our pilot program for the alternate 911, and what I got was that it was a workforce issue. As far as we had somebody hired and then they got basically hired away by someone else. That was all I got out of our conversation.
Yeah, pardon me. There's a number of different animating factors here. Yes, there's a workforce issue. Behavioral health specialists, there's just not, people are not seeking that type of job. And it requires at least a BA and potentially a master's degree or some level of experience. And so we're seeing, this is not a Bellingham or Whatcom County thing. This is probably a nationwide, certainly Washington State piece. So yes, absolutely. There's a workforce issue. So so I met, right. So even if we had all the money and we had the rigs ready to go, we would still need to hire up. So, and staff up, in other words.
Yeah.
And so I met with the mayor and finance and fire yesterday and a week ago, and separately with the mayor 2 days ago to discuss the urgency of this, try to figure out some kind of workaround solution like a hiring bonus, which we can't do. If they become city employees, they'll have a pretty good pay package and benefits package, including retirement. Whereas if they were hired from a contracting, like a community health center or clinic, they may not get that level of, compensation. But you're absolutely correct. There's a workforce issue, and then there's also an acquisition issue. So I signed off on buying 2 rigs for community paramedic about 2 years ago. They put in the purchase order 18 months ago. We still haven't seen them. They're back ordered. And so you know how these things work in government. Some things take forever. We could probably work around. We could probably go to our surplus lot, the ones that, trucks and rigs that we are ready to auction off, and maybe we could pull a couple from there as an interim, but we face the workforce issue. I'm confident that we have the money, we have the funds to fund it. It's about $838,000 for the first year, including the acquisition of 2 rigs and the 4-person staffing, two teams of 2, covering 7 days a week. But I am just really concerned right now.
Stephen.
Thanks, Barry. Dan, I haven't read 1310. And I haven't really studied the whole package of bills you're referring to. And I'm going to guess that I'm probably not the only one on the task force at that level of knowledge or ignorance. So it seems to me that there should be ideally a fairly thorough summarization of what passed in the big picture out of the session and what the local implications are of that before we're really grounded in making decisions or recommendations. Is that a possibility? Would it be useful to have some of our state reps actually appear, or a special meeting with them? I don't know. I want to be up to speed on this, but I don't think I understand all the, especially when you get down into the implementation details like you and Barry are. I don't think I'm equipped to evaluate the situation.
Yeah, and I was wondering the same thing. That was why I started kind of the question out about the health department and their involvement in this. And I was trying to think of what's the best way to kick this discussion off at the task force level, from like you said, Stephen, a summarization level, so we can get a good understanding. I'm,
You're still here. Jackie Mitchell is here as an attendee with her hand raised. Do you want me to promote her to panelist?
yes, please bring her in.
Sure.
Good morning, Jackie.
I don't know that I am the best person to speak to this. Anne was supposed to be here today and I don't know what happened, and Perry was supposed to be in attendance as well. So I'm the backup of the backup. But yeah, we've got some really serious issues, both in terms of law enforcement response to some pretty desperate situations. We're trying to work to address that with the long-term solution being with law enforcement, but the shorter-term solution being something on the order of training our workforce, existing workforce, to provide behavioral management and behavior modification, for example, in some of those housing locations that we provide funding to. And then, of course, there's the workforce shortage issue that Dan mentioned. That's a very serious issue that's being addressed at the state level as well as nationally. I mean, it's a national workforce issue. So we're trying to address it on many different levels, looking at both the long term and the short term, what we can do to help mitigate the situation right now. Because what we've heard is that there, for example, amongst our housing providers who are not skilled behavioral health workers and don't have skilled behavioral health workers, that there are many crises erupting, and they don't have anywhere to turn to get help. So and with Dan mentioned that we've been working on the alternative response team, and I feel the same way you do, Dan, that it felt like things were really coming together, and then we got this sort of sudden drop in the bucket there where law enforcement is being very cautious about the cases that they go out on. And I kind of understand their side of the equation. So anyway, there's no easy solution. What I've heard Ann saying is there's no short-term fix. There's no easy solution, but that we are working on the long-term solution with law enforcement, and our short-term approach again is to get resources, meaning consulting, training, and skill building to some of the teams that need it, that are facing the issues that this gap has left. So does that make sense? Did I make sense there? Okay.
Jack?
I'm sorry to repeat what Stephen said, but I can't really stress enough how important I think, Dan, it is to frame this. I mean, if both Stephen and I are completely lost in this conversation, I'm sure much of the task force is. This reminds me of one of these issues where some of the task force has a lot of information and others of us have virtually none. So when you say this House bill and how it affects, I would get an F on writing a summary on a paper of what that means. I don't know. And so I think to get a consensus or a recommendation from the task force, the first step has to be to frame it in a way we understand, ideally with a recommendation of what you want the task force to do. I thought Stephen's question was great. And I assume what that would be is a recommendation to council in support of remedies to address the situation, because I'm starting to pick up on, I think, what it is. But if we're going to put this on the agenda, I'm sure we agree, Stephen, it has to be framed for people really coming at it with little to no understanding of what it is you're referring to.
If I can respond.
Yeah, go ahead, Dan.
So this is the 1310 is commonly referred to as a use of force bill. And so it compels the responding officer, if they see a person who appears to have a behavioral health issue as defined by RCW, and there's a specific RCW that the authority is, if that officer's responds and the person appears to have a behavioral health problem, including intoxication on alcohol or drugs, which to me, what does that mean for Friday and Saturday night when Western's back in session and college students are downtown at our bars and they get out and there's, you know, there's some issue or whatever, can they just not respond? Or if the person has a mental health issue or appears to have a mental health issue. So there's a liability that is inherent here. And the way that law enforcement is reading this is that it's too much of a liability to respond to the call. And so in some cases, if there's no weapon present, if the person maybe is just maybe yelling on a street corner in public, then there may not be a response. Or if there's a response, they would leave the scene. So I just want to provide you that level of detail. I can send the bill to you, or you can look it up on, there's a website that contains all the bills. But I do agree, it needs to be framed. There needs to be a what is this? And then how does it impact the work that's being done? And then what can the task force do to help ameliorate it? So.
Stephen?
I'll let Jackie go first because I think her input is more valuable than mine.
Oh
Okay.
my, Stephen.
Go ahead, Jackie.
No, I was just going to add that I think the biggest impact we're seeing is in local law enforcement's decision to not respond where a criminal case is not involved. So that leaves our civil commitment cases where a person is very much out of control and sometimes even dangerous, sort of not being responded to. And then DCRs, of course, don't want to come in unless the situation is cleared for them and they feel safe. So the other negative impact here is that DCRs are not responding in many situations. So we're kind of getting hit from a couple different sides. But again, you know, just so that Perry hears this, because he wasn't here a few minutes ago, that I said earlier that we are taking both a long-term and a short-term approach. Long-term is addressing this issue with law enforcement of non-responsiveness, and the short-term being that we're working with our teams, including housing staff, et cetera, to develop behavioral management training, give them skills, et cetera, because of the lack of behavioral health workforce to respond to the issue as well. So, yeah, thanks.
Okay, Stephen, and then Arlene.
So just to go back to the framing issue, Dan, you referred to a broader set of bills, and if we could have some delineation of everything you think is contributing to the situation, and maybe eventually in a board packet, copies of the bills or web links to them would be helpful. I'll try to look at this, but I have two comments. Number one is I'm looking down the agenda at Jill's reminder to us that we've canceled an August task force meeting. So that would, are we talking about the July agenda that we would try to pull something like this together, which seems daunting. Secondly, I'm trying to understand what formal decisions we have from the sheriff's office or BPD or local police departments that would clarify what their position is on this. How all of this relates to the Crisis Response Center, which seemed to me to be the resource that we dumped a lot of money and program planning into for this, and now we can't even get people there. So I'm just trying to wrap my head around the totality of this, as Jack was saying.
Arlene?
I think a way of understanding law enforcement's response is to look at the larger picture of what's going on in our community and across the country. we do not have a leader in the Bellingham Police Department. Now we're in transition to finding a leader. So that makes the officers a lot more powerful in resisting dealing with this change. So it's in a way, it's understandable. It's very difficult for them to face what we're doing because we're switching the power where the power lies. You know, who's doing the lead. And it's hard for them. So, I mean, that's some of the reason. With leadership, I think you bring people along with good leadership. So that will be one thing about the choosing of the chief is going to be terribly important. The other thing is that if we're not ready to go with this, we cannot start without being ready and without having law enforcement buy-in. So that suggests a delay. But we don't want to fail. We want to succeed with what we're doing. And there are communities that have succeeded. So we need to follow their lead and use some instruction from them, the ones who've already done it. As far as staff is concerned, salaries are really important. I don't agree that it's not important. It's crucial. So when you're talking about salaries, I have no idea what you're talking about. Nobody is ever talking about a figure. What are these people getting per hour? Does anybody know?
I don't see any hands right away on that.
No, okay. Well,
Not
It's-
enough. Jackie?
It's different for different levels of mental health treatment. I mean, I couldn't sit here and quote it. to
no,
you
I'm
right-
talking about people who go out on call are going to go on this team.
Oh, on the team. Yeah. I think we could only tell you about the teams we already have, like Grace and Lead, that kind of thing.
Okay, so we don't have it yet, right?
Maybe not.
Yeah.
Possibly not. Depends on the construction of the team.
What do you, in a general way, what's the pay for the mental health part of those teams?
I think independently licensed person on one of those teams is getting around $34 an hour, and MHP is getting up to $30 an hour.
Okay, so I would say that's on the low side. Not for the Northwest, because our salaries are inadequate here. But that's my opinion, because remember, you're competing against private practice. That's the other salary that these people can get. So I just want to, emphasize that issue as actually pretty significant. But the main thing is that the training be extraordinary for this kind of work, because the variety of the kind of calls that they're going to go out on is just stunning. But a lot of it has to do with family conflict, addiction behavior, people who are out of control. So whoever goes out, their job is to lower the intensity of the crisis and take control, but without using force until they have to use force. The problem is that addicted people, when they're out of control, they don't respond to normal interventions. So you do need the backup.
Mike?
Sorry, got to find my unmute. Thanks, Barry, for calling on me. I want to go back to Dan's a point in how we frame it and what maybe our committee can do. And Dan, something, I should be more formal, Councilmember Hamel, something that the governor did with regards to the stay of evictions, right? It created a bridge. And there was legislation, creating a safety net. There was a gap in time, and there was kind of a legislative fix. And I think what I'm hearing from you, and I must admit, not being totally savvy on all of the nuances, it sounds like some of the changes are going to be enacted in law before an alternate system is in place. And why I think that's salient to this committee, because it will spike incarceration when people are not given access to de-escalation. And a lot of those stops by officers are not contentious as people think. A lot of them are quite friendly and helpful, and they stave people off from going further. And when they go further, that's when we start to see criminal behavior. So I think there is a very, very clear link between what you bring up and the work of this committee. And in terms of what are the most salient thing that we can do to help, Dan, is I'm hearing from you is that maybe a strong recommendation to partners that we work with other, maybe the Association of Counties from the health department side. I know law enforcement also has statewide organizations, but maybe finding what we can do to support / advocate for some type of a middle ground bridge. And Dan, I just wanted to ask you directly, is that kind of something that you're thinking or that you're hearing? I know you've been having a lot of conversations here. Is that maybe a direction that that community should be going?
I think so. Yes, definitely. What we need is time here. We need to buy time. When I sat down with a representative over the weekend, he did not know that this was going into effect in July. He thought it was going to go into effect of July of next year, after the AG would make recommendations on models of how to respond, and they would have provided a better environment for for communities to come up with solutions that are unique perhaps to their own communities, or maybe they could replicate off of other communities. We're not the only one. There's 291 cities in the state of Washington, over 10,000 people that have police departments. So everybody's getting impacted by this. So I think the steps are, we need to educate ourselves as to what is going on and to really understand what the implications are and what the impacts now are, and then to come up with some kind of recommendation or some kind of action plan that can help buy us time. Our fire, so this is already happening. This is not, July 25th is the date, but it's already happening. Our fire has seen a 50% increase in calls. We have 5 out of our 6 fire stations are over 2,000 calls per year now. So some of them are to the point of having to add extra units because they're so far behind, or they just can't respond in a manner that's sufficient. And a lot of these calls now, especially in the last 30 to 45 days, are behavioral health related. So what's happening is the line people are already trying to figure this out, and they're diverting a lot of these calls to fire. Fire is physical health and fires and broken cars, cars on fire or whatever, and burning buildings. But mostly it's physical health related, but yet they're being asked to respond. And mostly there's not a uniform training across any fire district, including ours, that can respond to this. So we're seeing things on the ground right now. So we're already behind. So I'd like us to perhaps educate ourselves as to what these 12 or 13 bills are doing. I can see if our policy analyst, Mark Gardner, can kind of consolidate these things and send them to this group, so we can at least start the process of educating ourselves.
I think Perry, you were next, and then back to Jackie.
Yes, thank you. And my apologies. I know that Jackie had shared a little bit. I was trying to get in as a participant as opposed to a viewer. I agree. And if it hasn't been referenced with many of the things that are being said, it seems to me that one of the things that law enforcement in various meetings that I've been a part of has indicated is that interpretation, particularly of House Bill 1310, and the language in it is that they were really looking for interpretation, along those lines. And prior to getting some more detail, in regards to that interpretation. They were implementing policy because it had to be done, as Councilmember Hamel had indicated, had to be done well before the 25th of July. And so part of my interpretation of that is that they chose to implement that policy in a very conservative way, given potential consequences for the law enforcement officers and et cetera. And that then resulted in, nope, we can't do pickups, from designated crisis responders relative to ITAs. We can't transport individuals that don't want to go. And we can't, if we show up to a scene and a crime is not being committed, we are, needing to leave at that point in time. So I think that some of that interpretation is going on, and I think that at least the information that I've heard from the sheriff's office, from Doug Chadwick, is making a real attempt to understand that further and then implement that policy. I don't know how much this helps, but thought that I would add that particular piece in. There's certainly quite a bit of discussion that's been going on in various groups that I've been a part of. The Crisis Stabilization Center Advisory Committee and some of the others talking about what can we begin to put together. For example, we have the Crisis Stabilization Center Advisory Committee meeting next Monday, and the providers wanted to talk about what do we do if an individual is at the facility and then has reached a level of acuity that it's not appropriate for them to be at the facility and they need to be transported to the hospital. Some of these questions that are coming up and that are being discussed as well. So I offer that information just if it hasn't been added by Jacqueline.
Jackie?
Hi, maybe I should cede to Stephen this time. I was just going to say that I think this issue crosses over with the Legal and Justice Committee because we do have law enforcement in attendance on that particular committee. And I certainly would want to try to figure out how to address the issue without their sort of input, feedback, partnership on it. So whether we were to ask someone from that committee to move over to this committee or hold joint meetings or have this handled on the Legal and Justice Committee, I don't know. Just seems to me like it would be appropriate to do something on that order. Any
Steve?
thought?
I'm going to follow up on Jackie's musing about structural context. And if it wasn't painfully obvious, my lack of knowledge on this, it will be when I ask the question. I've never been clear on what exactly the scope of the Law and Justice Council is versus the Incarceration Task Force. Is this the kind of systemic issue that we would take up under that? And does that tell us anything differently about how we would go about formulating a response? If not, just kick the question to the side and we'll go on more substantive questions. But
It's a good question, Stephen. I haven't attended to the Law and Justice Council's scope for quite some time, but I think it's basically the same as the task force, and Jill would probably remember the few differences that there are. But my thought was more about the Legal and Justice Committee that you and I sit on, that we have law enforcement already in attendance there. And so that committee might also be addressing the same issue. I think we even heard about it the last time we talked. So,
well, I think that's a great point. And similarly, Dan's and Mike's behavioral health subcommittee probably has even more active involvement from law enforcement. So somehow they ought to be in this discussion, clearly.
Is law enforcement, Dan, attending the behavioral health committee?
Chief Tanksley is in attendance, and Under Sheriff Chadwick is often there.
Sorry, I glitched out for just a minute. Raylene?
Yeah, my apologies for appearing late, but I think I got the gist of what's going on here. And I think the Legal and Justice Committee should be weighing in, as well as the behavioral health. It might be something that's going to have to be brought together at some point to get both sides. I know Chief Tanksley and the city prosecutor are going to be discussing that at the next council meeting study session here in Blaine. As there are a lot of questions, you know, even an officer that was in court yesterday had brought it up before court started, saying that he said there's a lot of questions. We're not sure if we're supposed to respond, if we have to leave. Do you know what is our role? What you know, if there's a crime, if there's not a crime and we leave, and then there is a crime and we were there but we didn't do anything, it doesn't look right either. So there are a lot of questions and confusion on what direction things are supposed to go in. So I'm hoping that with the study sessions and everybody kind of merging on this topic, that we can come back to the task force after some of the subcommittees have met and discussed this issue, and then see if there's changes that need to be made in any portion of it, whether the task force wants to make recommendations to legislature or if we think it's moving in the right direction. But we also need to have enough mental health professionals out there to help deal with this. And I think that shortage is also definitely a concern with changing the law so quickly.
So it's kind of, you know, it's our job, of course, to set kind of basically set this strategy up on how we deal with this. So what do we want to do in terms of the next task force meeting? Do we want to have any kind of a overview? Is there anybody that can do that? And B, is that something we want to take on in the July meeting, and then have our subcommittees take a real drill down look at it? Or what does this committee want to do regarding this topic, especially about the next meeting? Yeah, Dan?
You know, I hate doing things quickly, especially when they're complicated, but I think that we're sort of under the gun here, and I think we need to come up with solutions. So at minimum, I think that the task force should be educated on what's going on, what we're seeing currently with the uptick in fire, at least in Bellingham Fire taking over a lot of these calls, the status of the ART, the alternate response team, in relation to this issue. And we've got I think we have a one pager on it's 12 or 13 bills that were passed. And we can provide that ahead of time, and maybe have either Mark Gardner or Ann Deacon or myself can provide some level of detail on 1310, or maybe some of the health department staff could chime in on that. But I think we need to move on this, and moving to me means educating the broader task force, going back to committees and working. And I agree that legal and justice absolutely needs to be in on this, because folks are going to be drawing charges because there's not a de-escalation component. And so I'm really worried about patient outcomes here. So I think that so do the overview at the broader task force, and then get the committees to commit to doing some work within those structures, and then coming back at the next meeting, I guess would be in September, which feels late to me. But if that's what we're doing, then that's what we're doing. Or we call a special meeting in August to try to address this. And then I think a step, and I don't know where it goes in this order of operations here, is to have state representatives come to our meeting and let them hear from us the concerns that we have as we learn more about the implications of this.
Okay, so I guess that brings us to the who or, you know, what group of folks are the best to present that overview. So Jackie and Perry, do you have any suggestions from your angles?
Well, one of the things that I would certainly suggest, and maybe it was already implied by Councilman Hamel, that it seems to me that that piece, as it develops or as it's developed, that I don't have clarity in regards to the policy that's been implemented in regards to the sheriff's office and in regards to BPD. I don't know if it's a breakdown of communication as much as they didn't have it, within the time frame, and they were scrambling to do that. So I'm not suggesting, responsibility there, but without that piece, I really agree with what Councilmember Hamel was saying in terms of, first we need to be informed, but in that, in being informed in terms of the bills, I think specifically being informed in regards to the policy, the current policy that's in place from that structure of law enforcement is going to be absolutely crucial. So I offer that particular piece. I can't speak for Ann, but I'm certainly willing to work with Jackie and obviously talk with Ann in regards to a presentation. I happen to be off that week, so in July. I don't want to offer up when I'm not taking personal responsibility for it. But beyond that, I'm certainly willing to be a part of it.
Other suggestions how we kick this off?
It'd be good to
Dan,
have
go ahead, Dan.
Oh, sorry. I should have put my hand up. I think law enforcement coming in and explaining their perspectives on what they think the implications might be. So it'd be good to have Chief Simon and perhaps Sheriff Alpo, or at least Under Sheriff, not at least, but Under Sheriff Chadwick, since he's on the, on the task force, would be appropriate. I think we need to hear from them. And even to some degree fire, because the impacts are getting kicked over to them, and for us to understand what that means. Because when fire's responding to the behavioral health call, they may or may not be responding to the person who's injured or whatever the case may be, or another unit needs to come from a different station that's farther away. So it impacts response times significantly. And so it's these downstream effects that I think it's really important for us to understand, and it would be great to hear from the professionals that are doing this jobs.
Stephen?
Yeah, I think we're making progress on putting some shape to this. I think the July meeting needs to lay a pretty solid educational base on all the pieces of this. So if Mark can put together a summary of the bills, Jill and the invitation can encourage us all to study that pretty carefully beforehand. Perry, Jackie, Ann, whoever can give us the health department perspective. I think it would be really important to have either the policies themselves or some presentations from Sheriff Alfo, Chief Simon, and any of the municipal police and fire officials. I'm wondering if Prosecutor Ritchie would have anything to contribute to that background thing. And I agree with Dan that putting off any substantive discussion and action till September puts us even further behind the curve. I don't know how else to deal with it, though, other than maybe asking the task force to delegate some interim decision-making authority to this body to take some actions that seem more urgent than September in the interim. And I like bringing in some of our legislative delegation to supplement the background information or to hear our perspectives on this.
Jill, you have something?
I just wanted to ask Dan if you have those bill numbers or a list of those bill numbers to send that to me, and I can pull the bill summaries from the state website for information. I will still rely on Mark, though, to do a great summary. I can send that information around to all the task force members with a special note saying this is going to be a big topic for the meeting. Please review these materials and let's discuss. If something beyond the July meeting needs to happen, I would encourage calling a special meeting rather than asking the task force to delegate its business, if at all possible, to the steering committee. So.
Mike,
Thanks, Barry. Stephen, that was an excellent recap. The only thing as I was listening, I didn't hear you mention, and maybe I missed it. Whoever would be the most appropriate to talk about it from the behavioral health crisis response side, maybe who's in charge of the DCRs for Whatcom County. I didn't hear that voice. And I think that's a critical piece along with the police, because obviously they're going to be greatly impacted by this as well. And whatever policies or ramping up or adjustments that they may be doing, I think would also be critical in our July meeting.
I'm entirely in agreement with that, Dan. Thank you.
Jack?
So a couple of thoughts. Jill beat me to it on not delegating to the steering committee. As a reminder, unless things have changed, we're not a decision-making body. And intentionally, we're set up that way. You could delegate to the chairs or the co-chairs. You could delegate maybe to some people, but I don't think we want the steering committee. We have in the past delegated to the co-chairs to do things in between. And of course, we would likely take action that everyone has agreed to if action needs to be taken. On an issue like this, my experience is there are often multiple perspectives of what the impacts are, how they should be resolved, and where we are. So I think it's obvious that this issue needs to go before the task force. But what that also tells me is what I'm thinking we're getting in consensus is we have to invite the sheriff's office, the Bellingham Police Department, and those stakeholders to participate to get a full and comprehensive assessment from those different entities, as opposed to just one particular point of view. Because I suspect as we dig into this, there will be different points of view and different ideas of what needs to be done to remedy it. Perhaps the only thing we all have consensus on is we have a problem and it needs to be fixed. So I like the idea too of potentially alerting Eric Ritchie if he's interested. So it would seem to me we need to reach out to law enforcement, potentially the prosecutor, health department. Am I missing anything? And just say, look, and I don't know how formal that has to be. We could just say be prepared, because sometimes being prepared with robust discussion is fine and we don't have to do presentations. But I think it's important in the meeting that we hold space for all those different perspectives, points of views, departments know that they're going to be called on to share their perspective on this issue. And what we're trying to do now is really education initially, as opposed to recommendations. And that seems to me it's going to take at least 30 minutes or more of discussion to even get to the place where we have enough understanding to even get close to any kind of consensus or recommendations. At least that's my perspective as I'm hearing it. So, go ahead, Barry. Yeah.
No, I just was agreeing with you. Go ahead, Jack.
Yeah. So I think we need to reach out then to Bill Alfo, and we need to reach out to Eric Ritchie, and we need to reach out to, gosh, I forget her name. She's awesome. The acting Bellingham Police Chief, and just say, look, we're bringing this up. We're going to call on you. You can participate or not, and obviously the health department. I think Dan, you did a pretty succinct job of explaining your perspective and how it impacts Bellingham. So those would be my thoughts of how we structure it. So I think it could be a little loose in that we don't have to have people bring formal presentations, but I think they should be given a heads up that they're going to be called upon to make comments to inform us all of where we're going with this. So does that make sense, Stephen? Is that kind of where you're coming from on this?
Yeah, it makes complete sense, Jack. I think, some of those people don't always attend task force meetings. So if we could provide some special encouragement, I know Bill is often drawn elsewhere and Flo sometimes. Mike's mention of the DRC supervisor seems relevant also. So I don't know who would be responsible for making all these contacts and invitations, but yes, I agree with.
Yeah, see her hand just raised.
I was going to ask if Jill had enough information to put together an invite to all these folks.
I believe so. Other than you said the DRC contact, my attention was pulled away. Is that a specific person?
Yeah, I can help you with that.
Okay.
Jill.
And the other thing I was thinking is Mike Hilly is the EMS manager for the
I
county.
was thinking of Mike too, yeah.
I mean, Jill, you could send it almost generic to the task force,
I
but then
think-
say
Yeah,
that the steering committee recognizes that EMS, the police departments, the sheriffs, all have perspective and insight on this that is important that we'd like to hear from. So that way it's broad, but we're also calling out those individual perspectives we want.
exactly. That's exactly what I was gonna do. Thank you.
I
Jack.
figured that because you work well.
Yeah,
If you have
She knows this stuff, yeah.
I hate to jump out of order, but I'm going to step in front of Mike for a second and just respond to Jack. My own gut feeling, Jack, is that 30 minutes is not sufficient for this, that this is a pretty multi-layered, complicated, multi-stakeholder issue, and that we need to devote more time to it.
Well, when I said 30 minutes, I meant more just the dissemination. That was without discussion. But I think it's going to be 30 minutes-ish without much Q&A. I mean, just the problem with Q&A when you're partway through the dissemination is you may get your question answered as you get more information. So I'd like to get some facts out before we open it up to anything other than clarifying Q&A. Just that. So that's what I meant in the 30 minutes.
What do you think we should assign it as far as our agenda goes? 45 or a full
Well,
hour?
we typically don't need time, but this to me looks like it'll probably end up being an hour, and we don't have anything else on the agenda. So then this is obviously substantive. So, but in my mind, I would think we're at least, yeah, probably an hour-ish discussion, and yeah.
Mike?
Thanks, Barry. I wanted to ask, we've got a couple of mental health specialists on here. So Perry, Arlene, I think you might still be on NISBO's board. I'm kind of wondering if the DCR perspective might be enhanced by maybe Joe Valentine or somebody from North Sound, if they're up on this. And I was just curious from Perry, Jackie, or Arlene's perspective, who I respect greatly in terms of your knowledge of behavioral health, who else from that kind of arena would make sense? I think it's really important too, and we have a unique opportunity to bring together those that are dealing with behavioral health and crisis response and are knowledgeable about it. This is a unique opportunity to be in the same space talking about a shared issue with law enforcement. And hopefully it can even set a tone for future how we do things collaboratively, as opposed to something that feels like it's thrust upon. I would imagine if I'm law enforcement, I feel like this is thrust upon me and I wasn't consulted on how to work on it. So how might we set a different tone? And I guess just being intentional. So I think DCR makes a ton of sense because they're going to be impacted. And I'm just curious if the North Sound Behavioral Health Services Administration might also be one. And if any of you three had another suggestion of maybe somebody different or better that could be invited, because they're not task force members is my understanding, but who might be specially invited to be able to round out that perspective.
So
I think
my opinion, oh, sorry, go ahead, Arlene.
I think Joe Valentine would be very valuable because of his knowledge, his vast knowledge over 5 counties. So yes, I do think he would be a very valuable voice.
Yeah, my own opinion is that Joe just found out about this issue recently. I think Bellingham and Whatcom County are kind of at the forefront of it, kind of reacting very quickly as opposed to other communities that haven't reacted so quickly. So, but his attendance or one of his staff's attendance might be helpful in terms of considering solutions. At this point, I'm not sure he'd be as informative as he would be helpful in terms of hearing what the issues are and then helping us kind of with a bigger systems address to it. But the person that knows the most about it on the ground is really John Dukes, the DCR manager, and he's very knowledgeable about it, has been experiencing it, has seen its impact on housing providers and on his MCOT team, mobile crisis outreach team. So he's really probably the single best person to provide information.
Perry?
What do you think if we have a DCR to come along with the manager? Because it's the people whose feet are on the ground. They're the ones who really know what can be done and what cannot be done, as they have that direct experience. And also they're not as political.
Yeah, John's not very political and he's really knowledgeable on the ground. He stays very much in touch. I don't know if he's actually doing some direct work or not, but I would leave that up to him because of shortages, staff shortages, if he can have somebody come with him or not, or needs to.
Yeah, Perry and then Dan.
At the risk of being unpopular, one of the things that sort of is floating back there for me is as we talk about impact, it can sort of turn into attempting to convince the group. And honestly, I think that just by this discussion, the group is convinced in terms of significant impact. And so, you know, some data is going to be helpful, I think, but a lot of time spent there may not be as helpful in the larger task force meeting, only because of the fact that we're convinced, we already know and need to be moving towards, are there some thoughts in regards to, you know, the information, using that information to be able to come up with some initial answers and then more long-term. I agree with Jackie in regards to John Dukes being able to present just in terms of you know what they're experiencing, and also some thoughts about how are they adapting to that. And he's very much boots on the ground because he works at that level. I think honestly functions as a DCR in addition to being a supervisor there. So those are a couple of thoughts.
Dan?
John Dukes is on the ART development team, and he's just got a ton of knowledge, so I'll second or third that idea. And then Britta Johnson, or one of her designees from Lake Whatcom Treatment, might be another person to invite to this process. And I just sent an email to Mark Gardner to have him send that list of bills to Jill Nixon.
Let me just step in, Dan. Mark responded with that list and I just forwarded it to all of you.
All right, we're on it. Government's moving pretty quick today.
Doing it in real time, Jill. That's awesome. Anything else on this issue and other things for our agenda for the next full task force meeting? Stephen, you unmuted? Are you?
I am unmuted. I just wanted to thank Dan for bringing this to our attention and pushing the discussion a little bit. I appreciate it. It seems like it's front and center for us the next couple months.
Yeah, I echo that. Thank you, Dan. Okay, the other item we had was to consider was the Dr. Harris presentation that would be in September. Jill, what did you need from the group?
Dr. Harris sent an email asking for a little bit of focus on what the task force would want to hear from her about. That's included in your packet if you have that handy. If not, I can screen share. So I thought I would put this in front of you to have a quick conversation and maybe help her craft a presentation relevant to the task force.
Okay, folks looked at this? Raylene?
Well, one of the things that I thought was helpful at the last presentation that I've seen from Dr. Harris was the dynamics that they were able to use to pull data and to make sure that for racial equity purposes that she was able to pull data and use different tools than we've had available. So maybe some direction to make sure that the data that we're using is accurate and consistent, and maybe she could provide us some direction on how to do that, or assistance on how to make sure that we're getting accurate data with all races and ethnicities involved in incarceration.
Stephen?
Yeah, I think Dr. Harris raised the question, that a lot of her research focus and recent visibility is around legal financial obligations, which isn't, I think, what we want her to concentrate on. It is the data. So I would want to make sure Caleb was there, and I wonder if it would be worth a special invitation to Dr. Andrew Peterson, who is with the Administrative Office of the Courts and is advising the pretrial processes work group on data issues. And Dr. Peterson is likely to be our ongoing data resource. So the potential for him and Dr. Harris having some exchange around her presentation might be fruitful for the data piece of the task force's work.
Any other suggestions? Does that help, Joe?
Yep.
Okay. All right, let's move on to our next item. Defining a process for updating the strategic plan for the task force. So that's also, we have a copy of that in our packet. What are we looking to accomplish, Joe?
I just want to find out how you want to move forward with this. Do you want me to put this in committees again, or do you have another idea for how to do an update to the strategic plan?
Thoughts on that? Raylene?
I think we find a lot of crossovers on some of the topics, especially with behavioral health and legal and justice committees. So if this was to come together at a joint meeting, that we could discuss what is specific to legal and justice, what is specific to behavioral health, and then to be able to say, okay, but this one is a joint, that both committees need to work together on certain topics. I think there's so much crossover on different things that to just say, okay, legal and justice is going to take this topic, it's hard to do because we have so much crossover with the other committees. So I'd like to see it at least at a joint committee portion first, and then maybe separate it out.
Jill, do you have any recommended timeline for this, or is this just something that we're just getting into the hopper kind of?
No, in fact, this is something that the U.S. Steering Committee mentioned 1 or 2 meetings ago. Hey, we should update the strategic plan. That's the only reason it's on the agenda is to address that comment you guys made. I don't see a real need to address it at this particular moment, especially we've got some big things coming on the task force and committee agendas in the next couple months. But that's totally up to you. I'm just responding to some comments that y'all made at a previous meeting.
Okay, thank you. Stephen?
I agree. There's plenty on the plates of all of our groups, but I also think it should be in front of the committees first. I'm increasingly struck by the growing overlap between legal and justice and behavioral health. There are only 2 joint meetings, and I think I would encourage both groups to think about whether there should be more frequent joint meetings. And lastly, the way we've dealt with the strategic intercept model in the past has been less like what I would call a strategic plan, because it doesn't include any staging out. So I would hope that as we work on updating this, we think about what are our near-term emphases, our medium-term emphases, and our longer-term emphases within the strategic intercept model. And those would be my comments.
Anything else on the strategic plan? It sounds like the recommendation is that we put this back into committees. And I think Raylene makes a good point of the overlap between behavioral health and law and justice is critical, that they probably meet more often together. So maybe we want to suggest that, or do we want to run that, just take that back as chairs, take that back to our committees and see what the folks on the committees think? Dan?
When is our next joint meeting?
Joint meetings have been held in November and May each year.
Okay, I think I had to step away for just a minute, but I think I just kind of caught the tail end of what Raylene was saying. We have so much overlap, and now we have a lot more because of the legislation that's come through. I would consider meeting jointly as much as needed, given the rest of the rest of the year. I mean, I would meet every month together. I think there's so much overlap on these bills, and we have just kind of the normal course of the things that we've already discussed. So that's my take.
I could
I
jump
agree.
in out of turn super fast. Raylene, Dan, Arlene, since we're all here, what if we start with doubling it? We're only meeting twice annually. If we went to a quarterly, we'd double our frequency and see what that would do. I just want to throw that out wildly to all of the co-chairs here on the committee.
I'm in agreement. I think we need to double it up. I know that some of the committee members have discussed in legal and justice to shorten the length of our meetings, but I don't think when we have this joint meeting, we can do the short meetings. We have to, maybe we can do, we'll discuss that at the next legal and justice meeting on shortening the meetings, but maybe when we do meet as a joint, we keep it longer. Also, if we did quarterly, and I think with the summer months coming up and less people available because of vacations, that maybe we could look at doing a joint meeting in September. And then move forward with asking when we go to the next committee meetings with just our group saying, hey, this has been brought up. There's a lot of overlap. We'd like to do a quarterly joint meeting. And see what we get for a response. At least that's my thought on it at this point.
I think that September suggestion is a good idea. Dan?
Yeah, I agree with the September piece. We have 3 new people on behavioral health, and it would be beneficial, I think, for them to understand the context of legal and justice and the interplay between behavioral health and legal justice issues. So I agree, September.
I mean, I'm in favor of meetings as often as possible. That's why I started to invade the behavioral health committee, even though I wasn't invited, because I just want to know what's going on in that committee because of the way in which we're joined together. So
Always welcome, Arlene.
thank you. Thank you for letting me invade. Yeah.
It's a friendly invasion. It's taken as such.
Yes, it's very friendly. Yeah. So yeah, I'm as much as I don't need another meeting, I'm in favor of more joint meetings. Yes.
Okay, so it sounds like we have a strategy for the strategic plan update. Let's move on to our communication strategy and what our next steps are.
Where this was left off was with 2 things. First of all, Anne is developing that communications roster. In addition to that, this committee here had asked to have a draft for someone who, a communications specialist more focused on IPRTF work. I'm not any kind of a lawyer or anything like that, so I threw up some ideas here. Let me share what I've got so far, which is also in your packet. Is this still where you want to go? First of all, with looking into the possibility of hiring someone to create a communication strategy for the task force specifically. And number 2, is this draft scope of work that I've worked up in the realm of what you're interested in? And feel free to critique this however you need to. And this is a couple of pages here. There's 2 pages. So let me know when you're ready for me to scroll down.
Jill, I'll just say I found this to track pretty closely and pretty comprehensively the conversations I've been part of on what our needs are. So I think you got us off to a great start.
I would add in under the WHO and target audience groups. We're getting a lot of contact from business owners and employees that work in businesses in downtown and other areas of, and they're wanting to know what's going on with, in particular, folks with behavioral health issues or just kind of generally what's being addressed. I would just add in merchants or business into that WHO targeting.
Okay.
So Jill, question on with regard to the thought of hiring a communication specialist and needing some sort of a budget for that. How do you envision us approaching this, like through the council and, getting some budget authority?
I think the first step would be to have a conversation with Tyler. Unfortunately, he's not here today. But I think I'm comfortable if just informally approaching him and say, what are your thoughts about how we go about doing this? And just getting his feedback. He's usually really good with things like that. That to me would be a first step.
Okay. Mike?
Yeah, thanks. I see on the second page, Joe, educate the task force steering committee on how to create content that will engage the audience.
Yeah, that's for me. I personally envision this person picking a few core topics that the task force is working on and developing a communications plan around those topics. I also envision this person creating a sustainable sort of a how-to that we can use going forward, right, with future topics that come up. I'm not a marketing person, and so I would benefit just with some sort of a really detailed plan from a consultant saying, when you want to put a topic out there in the community, here is how you do it, basically. Does that help?
It does some. Like you, I'm going to add my disclaimer. I'm a good consumer of information, but I'm not a good creator. And so I think if it were left to our steering committee to create content that can be consumed on social media and digital, we might get into a kind of a lack of resources. Now, I don't want to speak for the rest of my fine steering committee members here, but I don't know that that's a skill set. But maybe if it's not to create the content, but to drive the elements of the content, and that we, as a steering committee, might still engage the services of somebody who can actually create something quality. I guess I just wanted to clarify that a little bit. I don't know if other members have the same thing. So I'm certainly happy to steer and say, I think this is an important topic. But if it came to actually like creating a GIF or an image or a downloadable document, I'm not sure that the steering committee is the best place to be the creator of content.
Yeah, no, I wasn't thinking that you guys would be creating the content. Just so that's a good thing to clarify for sure. I think it was more just about having the steering committee understand what goes into content creation that would then, of course, I would probably end up doing. So
okay, that's really helpful, and we could provide direction on like, hey, we think this is really important to cover with folks. We'd like it to have these elements and provide guidance.
Exactly.
Okay, thank you, Joe.
That's what I'm thinking of. Thank you.
Arlene?
I think it's really important to communicate to the public and not use the language that that we all use at these meetings. And I'm speaking about the jargon of this work. The public needs to hear what we are accomplishing and what we are looking to accomplish. Much has been done already, and that needs to be told to them. So the way it is told needs to be understandable and appealingly written. Sometimes if you tell a story about someone who was helped by one of the changes that has been instituted in the justice system, that gets the ideas across really well and in a strong way. Speaking in a theoretical way does not. People don't want to read jargon language, and they won't. So I'm urging that we use normal, everyday Anglo-Saxon language.
Yeah, that's a good point, Arlene. That's come up in a number of meetings that I've been in recently about just using plain language.
Yeah, I can definitely add that as one of the items here on this list.
Yeah,
Stephen?
I completely endorse Arlene's point about plain language and Jill and Barry's confirmation of that. I think that's critical to communicating with the general public. I want to disagree a little bit with the use of stories, because I know a lot of people find stories effective, but to me, they describe one person's experience that may or may not be representative, and they only show the application of background processes and structures that were visited on that person. So I don't think they really tell the story of the work that's going on in the task force. I think what I see in the public debate is that people don't understand the systems changes that have gone on over the last 5 years and that will hopefully go on over the next several years. And I wouldn't call that theoretical, but I would call it more comprehensive and not something that's captured in a personal story. So maybe a mix of the two, but the story is at best illustrative of some broader picture that I think would be the key to what we want to be conveying about our work.
Anything else on the communication strategy? And you wanted to know next steps. I guess we haven't kind of got to that piece of this yet.
If I can briefly jump in, sorry, I forgot my hand. I agree somewhat with Arlene on the stories and somewhat with Stephen. I think there's a fine line there that you can still share a story that's not just to one person. So if they used an example of friendship diversion services and jail alternatives being used by the county, one could say defendants are now able to continue to work and go to school without being locked up in the county jail. And we're seeing that with the scram, people are not using alcohol. I think some of those statistics, you don't want too many statistics because then it gets too broad and people skim through it. But if you threw in one that said, well, we have 94% success rate with people not using alcohol through this period, that says a lot for somebody that's been an alcoholic. And so that's still not just narrowing on one person, but it can be a group or a median effort that we're only putting one number instead of a whole bunch of numbers. Because I think it does need to be in layman's terms for everybody. And I think we still need to bring it down to a personal level without just singling one person out.
Dan?
I agree with both Stephen and Arlene, and Raylene's right. So data is never what we're trying to, the only thing that we're trying to talk about. And the thing that we're not talking about here is the what and the why. And so the what is that we're trying to keep people out of the jail. This is the prevention and reduction task force. It's literally in our name. And so I think we need to really make sure that that's clear. That's also in the why is because that we know that the jail is not the right outcome or treatment, for everyone. For some folks, for criminogenic folks that are just repeatedly doing things, that are against the law, then maybe that's a way. But I firmly believe that that's not the way. for most people, and that treatment and intervention services are the way. And I think we need to talk about that. That we need to explain that our goals are to reduce incarceration and to help people and to treat them as, you know, human beings, and to try to get effective outcomes. And for me, you know, just in the behavioral health realm, what the most important outcome for me is better patient outcomes. I want people to be happy and healthy and thriving and getting what they need, their basic needs met. So I think we need to really talk about those values. When we did the Home Fund the first time in 2012, we sought the help of Low Income Housing Alliance and some other folks. And they said, you know, always have data at the ready to make sure that you can back up what you're talking about, but make sure that people know, you know, who you're helping and why you're helping. And so we came up with effective strategies like, you know, every child should succeed in school and in life, and it all begins with a safe, stable home, things like that. You know, you talk about a value that everyone can go, yeah, well, that makes total sense. So I want to throw that out there, that we need to really be talking about values. I think that we don't talk about that very much in this group, but I feel that there's a shared sense of agreement on why we do what we do.
Couldn't agree more with Dan and Raylene. I think that would be the right approach.
Okay, so Jill, where would you like to see this go next? What's the logical next step? I know you mentioned talking to Tyler and to kind of figure out, you know, what we would do with this RFP basically, and how we would pay for it. But you know, what do you want out of us today to move this forward?
I think today probably just some sort of informal acknowledgement that I'm on the right path, number one, and number two, that yeah, the next step would probably be to just have an informal conversation with Tyler and get his input and input from the administrative side. So yeah.
Okay, Stephen?
Yeah, I'd like to add a piece to that it seems to me, in talking about how little we know, where we're really headed with this is to engage a consultant to help put together some of this communication. And so maybe that could be disclosed to Tyler, you know, seeking his guidance on A, the feasibility, and B, the process for doing that. And I'll just throw in that if including Barry in that conversation, or Jack and me, or the three of us, I'm sure any of us would be willing to take part.
Yeah, I was going to say I'd certainly be willing to take place in any conversations with Tyler or the executive on this. So
Okay, well, why don't I reach out to Tyler and try to set up an informal meeting? And in the meantime, if any of you have any additional changes or suggestions for this, please feel free to email me and let me know what those are. And depending on Stephen, Jack, and Barry and Tyler's schedule, I can hopefully maybe set up just a quick Zoom meeting to get his feedback. How does that sound?
sounds good to me, Jill.
Okay, great. Thank you so much.
Raylene?
My apologies if this is inappropriate. I would like to see this move forward as quickly as possible, because we have upcoming elections. And as much as I like to see certain people remain in their positions, there's always a possibility that that could change. And sometimes stuff like this needs to move forward, and I think everybody's in agreement. I just don't want to have to educate everybody else again if our parties change through the election process. Like I said, I'm not wishing anybody to leave or change on the committee. I just know how that kind of works when changes are made, and then we have to re-educate a lot of different people. And so I think this is a topic that should be able to move forward quickly rather than slowly.
Anything else on this? Okay, let's move to Gare. First of all, I have to apologize to Mike. I was unable to get on either of those webinars due to my schedule. I apologize for that. But maybe you could give us an overview of what you learned.
Before I go, I attended quite some time ago. I wanted to check if Stephen was able to join either.
Yeah, I was able to be on the, I think it was June 22nd session. To be frank, I didn't find it all that helpful. I didn't, it was for people thinking about GARE, and I was immediately the focus of some questions because we had already adopted the racial equity toolkit. So people wanted to know what our experience was and how we were progressing. And so we were, amazingly, we were sort of out ahead of most of the participants in that call. And I didn't get a full flavor of what we would get and what the value would be of our membership. I still think I lean in that direction, but it didn't help me move much.
Stephen, if I could ask you just another question, because it moved me, but I'm wondering if maybe reaching out to the director of membership, and I believe her name is Ariana, and I'm forgetting the last name, but in a more directed approach, which I'm willing to offer to do, and maybe to a core group of us that's not a quorum busting problem for Jill and the rest of us, to have like a one-on-one conversation about that. And so we could really, I feel like we need that to move this forward. And I feel like, me being galvanized and thinking that this will be very useful, we need more. We need more people to be exposed to that so we can have a little bit of a conversation and have some difference of opinion and then come to a consensus. So first of all, thank you for attending, Barry. No problem on not being able to. I'm sure your schedule is jammed. What does the steering committee think about that? If I were to try to reach out directly to the membership director and see if maybe we could arrange a conversation for a couple of us.
I think from my experience in that session, Mike, that's a great idea, and would be really valuable, and maybe the only way for us to get more information. I don't know if it would be the executive director or the gentleman who sort of chaired the session I was on. I can't remember his name, but we could figure it out. And I think expanding our knowledge base and the steering committee beyond you've carried so much water on this and been so valuable. But I think more of us need to participate in those conversations.
Would inviting someone to be a guest at one of these meetings be helpful?
Well, that's a really interesting idea. Then all of us really could be a part of that. I would think, and I will defer to Jack and Stephen and Barry, creators of our agenda for steering, how much time we could allot for that, and if they would be willing to join such a thing. But that's a really interesting idea. What do the creators of agendas for steering think about that and inviting that into this group?
Well, I guess it would be a question of how long it would take. I mean, that's from an agenda creation perspective. We want to know how long that we need to have that presentation be. I was just trying to think of something that gets us all the information at once.
No, and I think it's a better suggestion than what I was thinking of, Barry, which is like a one-off call. So if I'm not hearing objection from the chairs, I think if that's okay, then I would just, as an emissary, reach out and see if that's a possibility. And if it is, and if they might be willing, do we have an idea of which steering committee meeting that we might want to try to get somebody to come?
Well, let's start with the if. Stephen, Jack, what's your opinions on that?
For myself, I think that would be a good idea. The more of us who are grounded in this, the better. So I would also, I mean, I imagine whoever we're talking to is going to have a very busy schedule as well. So I would think of plan A is invite them to a steering committee. Plan B, invite them to a conversation with some representative group of us that fits in their schedule. And as for timing, I would think probably 30 minutes.
Yeah, thanks, Mike. I agree. I think it's a good idea as long as we can get the parts to line up. I mean,
Yeah, right.
that's the challenge. But you know what? They always say if you don't buy a ticket, you don't win the lottery. So we might as well ask.
That's right.
Sounds really good. Is there any objection for me to asking for our next steering committee meeting? Is that too soon for folks? I have no idea what I'll get, but okay, I'm gonna just take that as a charge. I'll run with that. And then I'll coordinate with Jill and obviously the chairs with whatever I find out.
And Mike, what a great segue to our next agenda item, which is, are we going to have an August steering committee meeting? So let's talk a little bit about that. We talked, one item is we are just a reminder that the general task force meeting at this point is canceled. So what's everybody think about August and the steering committee?
I'm fine to meet in August. I just think with just going back to our first topic, the changes in legislation, so theoretically we'll be able to go to the July main task force meeting, and then we do have committee meetings after that, if I'm not mistaken, for July, or at least I think we do, or behavioral health, third Tuesday. It would be nice to go back into this body in August to kind of come back with what did we learn? What did the committees, the subcommittees, what happened in there? And then we can be prepared for September. So I would vote yes. And I know that, we're getting meetinged out here. This is, I don't know how many hundreds of Zoom calls we've done over the past 15 or 16 months, but I think it's worth it. That things are imperative right now. So I would vote yes.
Stephen?
Yeah, I agree completely with Dan. I think we need to, as quickly as possible, push this topic that we started with today up the hill and prepare it for September.
Okay, how about a consensus check? Everybody thumbs up in your camera if you want to meet in August.
Well, it's not a thumbs up for wanting to meet. It's a thumbs up for willing to meet.
Meeting, yeah.
And
Yeah, sorry, I
let's
phrased
clarify for the record.
that. Heard. Okay, so we will meet in August, Jill, I guess at our regular scheduled Thursday. Okay, that brings us to anything else? Any other business, Stephen?
Yeah, Barry, could I just go back to that? I'm trying to page back and forth between the schedules. Behavioral health will have met after the presentation at the July 19th task force meeting, but legal and justice systems will have met before that. And so I don't know that legal and justice systems will have any meetings after the July task force meeting that we lay informational groundwork for. So I wonder if we want to rethink the date of the August steering committee meeting, I guess is where I'm getting with that.
Yeah, I think that's a good point, Stephen, because it looks like legal and justice meets, if there are meeting in August, it's the 10th, right? So, and what are we, Jill? Usually the second Thursday of the month?
Legal and Justice in August meets on the 10th and steering meets on the 5th. But I am going to ask Raylene and Arlene to stay after this meeting so we can put together the legal and justice agenda for next week as well.
Do we want to think about moving our steering committee meeting by, say, a couple weeks? Or 3, or whatever we think's appropriate?
Even one would have some input from legal and justice.
August 12th, is everyone available then?
I know I am. I don't have much planned in August, so.
Okay.
Mike, you're up.
Mike?
Yeah, I'm here on the 12th. Yeah, I leave on the 13th. I got my days mixed up, so I'm here.
Okay, I will reschedule.
That's the second week.
Okay, so that takes care of our agenda, unless there's anything else anybody has other than public comment. We'll go to that next.
There's no public comment, or there are no attendees here today.
Okay. Anything more for the good of the order then? Thanks all, very productive meeting. We did go a little over, but that's great. I think we got a lot talked about today. So have a great week, great weekend, and we'll see you at the task force meeting. We're adjourned.
Thanks,